Hello everyone, and welcome to our webinar for nurses, midwives and allied health professionals. My name is Nora Park, and I'm the manager for King's PhD program in mental health research for health professionals. I'll be administering our webinar today, and you will be soon hearing from the rest of the webinar team. Before we start, I just wanted to remind everyone that we are recording the webinar, and the recording will be made available later on our website. Also, please mute yourself during the presentation to minimize any disruptions. You will have a chance to ask questions at the end of the presentations, and you can also post them in the chat as we go. We will go through them during the Q&A session. We will also go through your pre-submitted questions, so no need to resubmit those. Thank you very much.
Okay, good afternoon, everybody. Very nice to have you here with us. My name's Alan Simpson. I'm Professor of Mental Health Nursing at King's. I'm one of the co-directors of this PhD programme, and I'm leading on partner organisation and clinical liaison for the PhD programme. In a moment, you'll also be hearing from Professor Rona Moss-Morris, who is Professor of Psychology as applied to medicine. And Rona is taking a lead on training and welfare for this PhD programme, and she'll be telling you a little bit more about the programme and some of the emphasis on equality and diversity. And then I'm very pleased that we have with us this afternoon Professor Catherine Evans, who's Professor of Palliative Care at King's and also Deputy Director of the King's Clinical Academic Training Office, which has been set up specially to support people who are developing clinical academic careers with King's, and she'll tell you more about that and the support that can be offered from that office. And you've already heard from Nora, who's our fantastic programme manager, who's overseeing everything. She's the person who's organising all of this and will have been in contact with you. So thank you, Nora. So in the webinar today, some of you, if not all of you, will be aware we ran another webinar last week, which is available on our website, which gives a full detailed breakdown of the whole programme and lots more information. So if you haven't already seen that, I would recommend you have a look at the website and click on that and watch that webinar. But today we will give a briefer recap of the overall programme, give you an idea of what the programme is about, what we're aiming to do. We'll speak about the goals for equality, diversity, inclusion, which are absolutely central to this programme and really important to us. As I've mentioned already, you'll hear about the King's Clinical Academic Training Office and the clinical academic pathway for nurses, midwives and allied health professionals. And then we'll be really focusing in on some guidance around the application and the things that you need to do for the stage 1 application. There are 2 stages. We'll be focusing here on the stage 1 and then giving you a little bit of information about stage 2. We've already got a load of questions that people have submitted, so we'll have a Q&A session where we're answering those questions that have been submitted, many of which I think will be covered in the presentation, but we will go through each of them. And if you have any other questions as we're speaking, please put them in the chat and Nora will pick those up and feed them to me towards the end of the session. So again, thanks for coming along, and I'm going to hand over now to Rona. Thank you very much.
Right, thank you and welcome everybody. And just apologies in advance. I'm only able to stay on for half an hour, so I'm suddenly going to disappear. But it's not because I'm not interested, but unfortunately I have another meeting. So great to be joining you here today. So just to recap on the program information, overall we have this pot of funding for 5 years, so for fellows basically, which started last October 2022. So we brought in our first cohort of people in 2022. Basically, what it covers you for is a 3-year fellowship. So it needs to be, obviously, people need to apply within this period of time. So this is the 2nd year that people apply, and then there'll still be an opportunity next year. And that actually covers all your home fees. So if you are you're eligible for UK home fees, it covers your salary. So it relates back to the salary that you're currently earning in your post. So this is a fantastic opportunity because most people, once you've been out there working for a while, trying to live off a PhD stipend, I can tell you, I have a few people doing that. It's quite a challenge. So it is a real privilege to be able to do that. There's also research costs, so costs related to the PhD research up to 50,000 per candidate. And also, there's also opportunities for some travel expenses, including some childcare and training costs. So it's a very generous package from the Wellcome. If you are successful and you do the PhD, you'll be awarded a PhD from King's College London. So that is the affiliation you'll get. The department that it'll vary which department you're in, and actually the title of the PhD will also vary depending which department you're in. You'll actually get an employment contract from King's College London, and if necessary, you can organise it as a secondment if that is the preferred option. So there are full eligibility criteria on the website. So really just in terms of the highlights, the kind of key thing is that you do need to be a practicing health or social care professional, and you need to be registered with the National Professional Regulatory Body. So obviously that's going to be, the actual regulatory body will differ. So it'll be something like the HCPC, the General Medical Council, Nursing and Midwifery Council, depending on what your professional affiliation is. And you need to be registered in the UK or the Republic of Ireland. So this is not open to people registered in another country. So the key thing, if you're thinking about this program, is that the purpose of it is to support healthcare professionals seeking to combine a clinical and academic career. So it's the idea that what we want to do is enhance people's opportunity of being able to be both an excellent clinician, but also an academic at the same time. And then just to highlight, because this is very core to the bit that we put in and that the work that we do ongoing here at King's and relevant to this program, is the issue around equality, diversity and inclusion, our EDI quality. So EDI is sort of overarching, I should say, not quality, theme, as it were. And our goal here is to develop and maintain a diverse and inclusive workforce. So with that in mind, we have 3 underrepresented groups that we particularly encourage applications from with these particular characteristics. So this includes health professionals with a lived experience of mental disorders. It doesn't mean that you can't apply if you don't, but we are encouraging applications from these 3 groups. People from diverse racial and ethnic groups, as well as, and we particularly also encourage applications from nurses, because this is an underrepresented group in this clinical academic space. So I think that's pretty much all from me, and I'm now going to hand back to Alan.
Thank you. I think now it's time, thank you, Rena. Now it's time for Catherine to tell us about the Clinical Academic Training Office.
Thank you, Alan. So as Alan said, my name's Catherine Evans. I'm one of the Deputy Directors of the King's Clinical Academic Training Office. So the office is run by our Director, Professor Fran Williams, and my other Deputy Director, Dr. Rena Tutter. And the reason we're flagging this now really is to sort of demonstrate how the importance of building clinical academic careers and King's commitment to achieving that. And the reason for that is that King's has very much an ambition to be supporting, nurturing, enabling the future clinical academic leaders. So that's sort of where our ambition is across the various healthcare disciplines. So the purpose of the King's of Cato, as it's called for short, is that it provides a centralised pan-professional liaison and academic training hub. Basically, it's the go-to place for information about funding, mentorship, support, and works in a very multidisciplinary way with nurses, midwives, AHPs, doctors and dentists. And our intention is to be supporting individuals to be able to progress their career as clinical academics. We're very aware, particularly at those points of transition, for example, for individuals on this call, when you've completed your doctorate, in ensuring that there is a plan in place as to what happens next after that doctorate, so you can continue on your career pathway as a clinical academic. So on the slide, you've just got the links to our website. I'll also pop them in the chat as well, where you can see more information about what we do. Next slide, Nora. And what I want to do, the purpose of this figure is just to sort of illustrate, when I talk about a clinical academic pathway, well, what does that actually mean if you're a nurse or an AHP or a midwife? And this is us just basically beginning to map out what that pathway is. So in the middle, we have the doctoral point in people's clinical academic training. And you can see on that is the Wellcome PhD program that you're hearing about today. And you can see on either side of that there's also support for individuals who might be thinking, oh, well, am I a bit early for a doctoral funding application? Which is also important, particularly for the underserved groups that Rona has flagged, that often for those underserved groups that they've had little opportunity for exposure to research. And it might be that they would require, first of all, something like a pre-doctoral funding. So within London, we have a HEE funded doctoral pre-doctoral places, as well as through the NIHR's national pre-doctoral clinical academic program called PCAF. And then right at the beginning of this pipeline is also opportunities for internships. And again, this is for individuals who might have had little or no exposure to research, and it's to give individuals that initial taste of research. But what we're talking about today is the doctoral funding application. And also, as I was saying, importantly, part of the Cato offer really is to be supporting and signposting individuals to that transition from completing a doctorate to being a postdoc. So for example, this Wellcome program also includes bridging funding for people at that postdoc stage. So very much what's important is that we have a clear offer across that pipeline, and the big blue box along the bottom is some of the infrastructure that we draw upon to ensure that people are successful at doctoral level. So thank you. I think that's all for me. Please do contact us in the Cato office. Nora is also our program manager if you have any other questions about Cato. Thank you.
Thank you very, very much. That's great. Just to underscore that we have worked, a number of us have worked with and supervised people who have undertaken or are undertaking currently those pre-doctoral training programs. The NIHR one is very good, and it gives people usually a year, sometimes 2 years, to do some training, develop their research knowledge and skills, and start working on a proposal for a PhD. For anyone who thinks, well, maybe I'm not quite ready for the doctoral program yet, that is a very good thing to start thinking about and looking forward to apply. And we'd be happy to give more advice on that. Sorry, I just lost my place. And as Catherine has just mentioned about the postdoctoral support, that is a part of this program. So there are a small number of postdoctoral support grants going to be available for some of our graduates, but in addition to that, the team will be looking, and the Cato office will be very much looking to supporting people once they've completed their PhD or as they are completing it, to help them think about their next career stage, what possible opportunities there may be, either back in clinical practice or in the academic sector, or perhaps in an industry, and also looking for possible funding opportunities for postdoctoral fellowship and career development. So that's very much central to this. It's about helping people start to build and develop a clinical academic career, and us helping to support you to develop that fully. But anyway, let's talk about the application for this program. So as I said at the beginning, it's a two-stage application. So the first stage is when we want to know about you. We want to know a bit about you, what your interests are, what expertise you have in doing research so far, and I'll come back to that, say a bit more about that in a moment, and what your thoughts and plans are for developing your clinical academic career. And that's what that first stage is going to be based on, rather than at that point your research proposal. The research proposal comes at stage 2. But anyway, let's just have a look at this. So first of all, we are focusing this call on 3 key areas. One is translational neuroscience, 2 is data science and digital technologies, and the 3rd is society, policy, and mental health. And if you're not quite sure where you might fit in that, I suggest you have a look at the program website, where there's a detailed breakdown and explanation of each of those and the sorts of things that we're including in those and the things that we're interested in. And if you have a look at that and you've got an interest or a research idea that you think perhaps links across one or more of those programs, that's absolutely fine. We're open and interested in people perhaps are trying to combine, say, a focus on society and policy, but also using big data sets. And so we're open to that, but have a look and see where you think you would fit into that. But that's very much the umbrella fields for this call. So if you're interested in the things that you passionately want to do, if you look at that and you think, oh, it doesn't really fit, then it's probably not worthwhile putting a lot of time and effort into this application, because it probably won't get selected. If it's not going to meet those criteria, then you probably need to look at other sources of funding. But it's pretty broad brush. We're not prescriptive within those headlines, but do have a look on the website and get a bit more detail about that. So what we're looking for in that first application, stage 1 application, is what motivates you to pursue research in mental health? What is it you want to do? What is it you want to achieve? What are your interests? What sparks your interest? It might be your clinical work. It might be some research you've done previously. It might be some research papers you've read. But what's motivating you to get involved? What research areas are you most interested in? And how might research in this area lead to improved mental health of individuals or populations? So we're already asking you to start thinking about, not just about you and your development, but how is your research going to feed into the evidence base to improve healthcare for individuals and or populations? What have you learned or gained from your exposure to or experience of research? Now, some of you may have already completed a master's degree or done some sort of research project, but you're not excluded if you haven't. So I make that very, very clear, and particularly for nurses and allied health professionals. We're very aware that many people may not have had those opportunities yet. But what we are looking for is people who in their clinical work and in other areas of their life have already shown a bit of an interest and some initiative to get involved in something. You might have helped on a research project, you might have done a quality improvement project with a team of your colleagues, or you might have published an article arguing about something to do with research and improving service or something like that. So looking for some sort of evidence that you've got some inclination in this direction, some interest. And just tell us a bit about that and what sort of things you've done. And then we want to know, why is doing a PhD important to you? And how does this relate to your professional research and career aspirations? And just to emphasize, this program is very much about developing and promoting and supporting clinical academics. So if you're looking at this and you're thinking, well, I'm a lecturer in nursing and I've always fancied doing a PhD, and you just want to do it because it would be nice to have a PhD, and there's nothing wrong with that at all, but you're not really thinking about developing a clinical academic career, then again, this funding scheme is not for you. You're not going to be successful. This is very much about people who've got some clear thoughts and ideas about, I want to do a PhD, I want to develop my research skills, I want to draw on my clinical expertise, and in the future, I'm looking for opportunities to try and combine and develop the both of those together. So it's quite important that you realise that that's what this program is about. And then finally, in your stage 1 application, if you have had any formal research training, do tell us about that and tell us about any skills or knowledge that you've developed. It may be a formal research course, it may be something slightly lower key than that, but do tell us about that. Those are the sorts of things we're going to be looking at and scoring in this stage 1 application. Thank you, Nora.
Thanks, Dan.
Okay, I was thinking we had another slide then, but you obviously don't. Great. Okay, cool. So that's it in a nutshell at this stage. Just to say, what happens after stage 1 is everyone who applies, we have a panel of the directors and deputy directors. We will all be reading and rating all of those applications against preset criteria. And then people will be invited to go on to stage 2 or not. Stage 2, which opens in the new year, requires you to identify a possible supervisor or two from our list of supervisors on the website, and to start working with them to develop a research proposal. And you have about 3 months to the beginning of April to develop that, and then submit a proposal, which again will be scored and rated, and then a number of people will be invited to interview to present their work and their proposed work and to answer questions about that proposed work. But that's stage 2. There's more information about that on the website too, but let's focus now on the stage 1. So we have some pre-submitted questions. So I think what we'll do is, Nora, if you're happy to read those out, and Rona and I will answer as many of those as swiftly as we can. And Catherine, if there's anything you want to chip in on, please do.
Thanks, Alan. So if we start with the pre-submitted questions, I've got several on eligibility.
Yeah.
So I have a candidate who is a registered mental health nurse, but their role is academic rather than clinical. So they're teaching student nurses.
Yeah.
They're asking whether they would be eligible to apply.
As I've sort of tried to stress, we really are looking for people who are still currently active. If you aren't at this point, but are keen on applying, then what I would suggest is looking for opportunities to perhaps spend some of your time back in practice to develop, have that foot in the clinical side of things, because I can't stress it enough. This is very much about helping people to develop a clinical and academic career. So if it's someone who is solely in the academic side and is not involved in the clinical side, then that is going to go against you, and it's going to be harder for you to be selected for this program.
And the second question is a dietitian who's not working in mental health, but they are asking whether they have to be working in mental health particularly to be able to apply, or if it's enough that they're interested in the area.
Thank you, Noah. Yeah, so we're certainly welcome applications from dietitians or any other allied health profession. You do not currently, as far as I would understand it, you don't currently have to be working in mental health. What you do need to have is an interest and a research idea that addresses a mental health issue. That is going to be the focus. So you may have a different clinical base at the moment, but your proposal will be very much about a mental health research focus that fits into one or more of those 3 programs that we have offered and that I outlined briefly earlier. So yes to dietitians and allied health professionals. Fine if you are working in a different setting, but the research really needs to be focused on a mental health question.
Thanks,
Perhaps if I can just add to that, I think, you know, we are sort of very keen to work, and a lot of us do, both Matthew and I work in the area of integrated health. So the ideas of kind of looking at links between mental and physical health and aspects of it. So that absolutely is well in brief, as long as that's quite clear how that interaction sort of happens.
Thank you, Remy.
And how you're going to research it. Yeah.
Thank you.
And the third one that I've got is quite similar. Someone has a degree in child field nursing rather than adult, and it's not in mental health but generic nursing, and they're asking if that will be all right.
Yeah, we welcome applications from any branch or field of nursing, and as I stressed before, any allied health profession as well. Yeah, so that's not an issue, providing the research project is going to link in some way around addressing mental health needs. And as Rona's absolutely rightly emphasised, there is a big interest in integration of physical and health. So if that's your interest, this is the programme for you. So yeah, very much so.
And you can certainly research both children and adults, although obviously doing research with children is always is more challenging because of all the approvals that you need, but it's certainly possible in the context.
Yeah.
Actually.
Thanks, Rona. Then the questions that I've got are more about academic background and eligibility. So someone has asked whether there are specific requirements and if research background is integral for the application process.
So you don't necessarily have to have a formal research background. But as I've said, and I'll say again, and Rona, feel free to please add to this, we are looking for people who've shown some previous interest. Just to say, we have had applications for other programs in the past where it's been very much about research, and then people have barely mentioned research. They've told us all about their clinical skills and all the wonderful things they've done in their clinical work, which is great. But what we're looking for is people who've shown some interest, some initiative in some aspect of research. And I've said it might be quality improvement, it might be some auditing work or something, but some evidence that either you're drawing on research or you've been to a conference and been enthused by something and you've tried to learn more about it, but some evidence that you've sort of engaged in research in some way. Obviously, if you have some other formal research training, that's to your advantage, and that's great. But because we are specifically targeting nurses and allied health professionals, we know very often people haven't had those opportunities. We are trying to be a little bit more open with this program around those issues.
Excellent. And then I got two questions about postgraduate diploma and MSc, whether the diploma is sufficient or whether it would be better to have masters, and what the view is between the two if someone's applying. Yeah,
so there's no minimum requirement in terms of previous qualification. Obviously, if you have a master's, that's great. If you have a postgraduate diploma in research or something like that, that would be great too. So yes, you don't necessarily need to go out and make sure you've got your master's. If you were able to do that in the next year and then apply the following year, that might probably give you some advantage, but it's not absolutely necessary. And yeah, sorry, that was it.
Thanks, Alan. That's great. Did you want to say anything more on that, or shall we move on to the next one?
No, next one, please. Thank you.
So someone's asking if they were successful and mental health is not their current remit in clinical practice, would we be able to facilitate that? And a similar one, if clinical component that they're working on currently is not mental health, can they continue with that?
So if mental health is not a current remit, can the department help to facilitate clinical practice? Yes. So that's a good question. We could certainly have a conversation with you and look at whether there might be opportunities for you to have clinical practice in a clinical setting. So we work very, very closely with King's Health Partners, but we would also be willing to try and help facilitate discussions perhaps with another host organisation. So it's not something we could guarantee, obviously, because we would need the agreement of a host organisation. So obviously it's beneficial if you have a clinical placement in mental health now, but we could certainly discuss that with you and look at whether there was something we could help support you with. But I couldn't promise that we'd be successful, as it would depend very much on the response we get. But we would certainly know people we could speak to and ask and make inquiries. Yeah.
And the second part was whether the clinical component can be outside of mental health if someone was successful.
That's a good question. I'm not 100% certain. I think probably, but I think we probably need to check that one and get back to you on that one, if that's okay. Yeah, because I think it relates to also the other person earlier on talking about working in a different environment. So let us check that one, unless you're sure, Nora.
No, yeah, I think it's best to check about this. It's not something that has come up before.
No, we'll check that and get back to you, and we can respond to any questions that came in directly, and we can put it on our frequently asked questions bit on the website as well.
That's right. Thanks, Alan. And the remaining pre-submitted questions are related to the program itself. So someone is asking about a part-time option for those with families or young children.
Yeah, so it is probably beneficial to do it full-time if at all possible, but we understand for many people that's going to be difficult, particularly with family commitments. So yes, part-time study is available, and certainly in circumstances where it's a requirement because of family needs and so on. What we're not able to do, because Wellcome won't allow it, we aren't allowed for people to hold another job where they would be doing another job and doing their PhD part-time. Wellcome won't allow that, so we're not able to support that. But if it was for family support needs, yes, we can offer a part-time option, and we have done that in the first cohort.
Excellent. The next two questions about the minimum length of the program, and if someone has already experience in research, can they expedite or do it in a shorter time than 3 years?
No, as far as I'm aware, there's no possibility of reducing the length of programs. It's a minimum 3 years full time. Great if you already have experience and expertise in research. But what I would say is a big part of the application and your work with your first supervisor in developing your proposal is to identify a training program. So whatever you have done before, I'm sure there are new things you could learn. King's offers an awful lot of training opportunities, and we would be looking for you to be further developing your knowledge and expertise as part of your training and development.
Thank you. So that was all pre-submitted questions. If we go now through the ones in the chat. So we have one from Grace regarding social workers registered with Social Work England and whether they're eligible.
I think they are, aren't they, Nora? That's right.
That's correct.
Yeah. Yeah, we can accept proposals from people registered with social work registration bodies. Thanks, Grace, for your interest. Hope you all apply.
All right, I think we've got a question from Sirad about the funding and the program length. Well, we've covered those just earlier, so I think that's fine.
Sorry, Nora, apologies because I came in late, so I didn't catch that bit. So I don't know if this is just possible just to quickly repeat.
Yeah, so what was your question?
So it was just to check around if the program's fully funded, how long it is, like is it part-time, full-time? Those are the two main ones, sorry.
Yeah, that's all right, that's fine. Yes, it's a 3-year program full-time, and it is possible to do it part-time. The funding is that your fees will be paid, your salary roughly equivalent to what you're receiving now would be paid, and there's up to £50,000 for actually research support costs for actually running a research study, and there may be other funds available for childcare costs if you need to go away for parts of your study and so on.
Amazing, thank you.
Yeah, it's a very generously funded program.
It's a very generously funded program.
Yes, hence high competition for it. Thanks for your interest.
So the next one is from Olu Bukola, and they're currently in the second year of a 3-year part-time MA in ACP. When would be an ideal time to apply for the program?
Sorry, I didn't catch the name, but is that person able to come on and speak?
Olu Bukola, would you like to join?
I think she put she or he, sorry, put a message after saying they had to leave.
Okay, thank you. Well, so it was in a year 2 of a 3-year course, is it?
Yeah, it seems right.
An ACP, is that Advanced Clinical Practitioner?
Yeah, I think it is Advanced Clinical Practice.
There'd be no reason why not to apply now with a view to starting it in a year's time if it's a 3-year course, I wouldn't have thought. Yeah, or spend the next year getting it ready and then apply the year after. But either I think would have been an option.
Excellent. And then we got a question from Rianne about whether the fellows need to be based in London or travel to London.
So you don't have to be based in London. However, we are expecting and will be asking students to spend some time at the university, partly about building their relationship with their supervisors, partly about building their relationships with other students and the benefits of having contact with other students and researchers and academic and clinical staff. So what we say with this is it's something we would look for you to discuss with your supervisors whilst developing your proposal and see what seems to be feasible and doable. And of course, it will partly depend as well on the nature of your proposed research, where you'd be undertaking that, whether it's sort of lab-based and at King's or whether it's out in the field somewhere. So lots of possible implications of all of that. So it is possible to do it not being in London, but there will be phases of the programme across all 3 years when we'll be looking for a presence on campus.
And then the next one is from Emma. Would a newly qualified nurse be considered with previous published research experience and previous clinical experience, but not as an RMN?
I'm very sorry, could you read the whole question again? I didn't catch the beginning.
Sure. Would a newly qualified nurse be considered with previous published research experience and previous clinical experience, but not as a RMN?
Yes, in a nutshell. Yes, so if you're a qualified and registered nurse, we would be interested, even if you're newly qualified. I said on a webinar last week that historically in nursing, there's been a tendency to say to people, go and get 5 or 6 years clinical experience before thinking about doing a PhD. And I think compared with other disciplines, that's probably been a mistake. And I think if we've got enthusiastic, interested, newly qualified clinicians keen to do research, we should be encouraging that and encouraging to develop clinical academic careers. I think it's good for them and good for the profession and good for improving mental health services. So we would certainly recommend that. And if you have previous research expertise and clinical expertise and publications, great, go for it.
Great, thank you. The next one is from Andy. For people with lived experience, is there any additional wellbeing support available at King's?
Yes, definitely. So we actively support applications from people with lived experience of mental health problems. And there's a strong program of support for all of our students and a strong program of welfare and consideration for supporting students. And anyone who has any specific needs that they would like additional support with, we can meet with them and discuss that if they're offered a place and ensure that's provided throughout the program.
Andy, did you want to say something?
Yeah, just to give a bit of context with that, I remember how stressful my first degree was, and the concern would be the stress of the PhD. So it's great to know that there's some extra things in place there.
Yeah, and you're absolutely right. And you know, I'm supervising a number of PhD students, and then I remember myself, you know, nearly cracking up at a couple of points in mine. And I'm not saying that lightly; it was seriously stressing. And so yeah, and I think universities and certainly here at King's, we're increasingly aware of the need to look out for the welfare of our students. So that's been a big part of the planning and development of this program, to think about how do we support our students.
I appreciate that. Thank you.
And anyone with any specific needs, we would have a conversation and see how we can best support you. Yeah.
Excellent. Thank you.
Thank you for asking the question.
Andy, I can definitely attest to that because I used to coordinate all the student nurses at King's College in my previous trust, and the mental health support was brilliant. So it's, I can definitely attest to it.
That's lovely to hear. Thank you.
I think Anna, you've had your hand up for a while. Did you want to jump in at this point?
Yes, I did write my question in the end because I wasn't sure if we're just going to read the questions.
Hi,
sorry. Hi. So my question is, I think it's partially answered, but it's just to clarify. So I imagine we cannot keep any clinical hours from our current job because of what you said, so we can't have other jobs. So I guess that would qualify into that. And then following up on that, so if we can't have any clinical hours, so previously I've asked and I was granted that I could have a secondment from my trust to do a PhD, and that way I wouldn't lose my benefits, but I wasn't working for the NHS. So is that okay, I guess?
Yes. So first of all, on the clinical hours, just to clarify, we encourage and welcome people to work up to a day clinically whilst undertaking their PhD. So if you have a post at the moment where you could be either employed at King's to do the PhD or seconded and work a day a week, that's great if it's doing clinical work.
Perfect.
And in terms of who would employ you, just to re-emphasize that, so there are two options basically. You can either come and, if offered a place, be employed by King's, and you would get a contract with us, and all your terms and conditions would be with us. Or, and for some people, certainly in the NHS and perhaps for other organisations, there is an option of being seconded. So you would remain employed by your current employer and be seconded for your period of time of undertaking your PhD studies. And for some people, there are benefits of that, certainly with the NHS, sometimes around pensions, but there are pros and cons of both options. What we've done, so both have been available to our first 5 students who were recruited last year. We've got a mix of people going forward on that. What we've done with each of them is met with them once they were offered a place and discussed the best option for them, and discussed it with their institution when they wanted to remain with their institution. Obviously, also depends on that institution being willing to allow someone to have a secondment and keeping a job open for them on their return.
Thank you.
My pleasure.
Thanks, Ellen. A related question from Juliet about who the employer would be, and the worry about losing NHS pensions and the holiday entitlement.
Yeah. So just to be clear, we have had meetings with very senior people in HR and everything within King's, and there are ways of doing that where you should be able to protect your terms and conditions and be employed at King's. But there is also this option of being seconded if you wish to retain those benefits, which I do understand it is an issue. It's a national issue, by the way, which is being faced by many people in many organisations. But yeah, we think we have a way forward which works, but we would discuss that with you.
Excellent. Next one is from Maria. Would a dissertation at degree level that was focused on quality and service improvement, which included development of project plan and literature review, suffice as a previous research experience?
Yes, in a nutshell. Yeah, I mean, anything like that would be great. And what we'd be looking for in the application is you to tell us a bit about that, your involvement with it, what you've learned from it, how you want to build on it. So yeah, any research experience like that would be useful.
She also asks whether it would be expected to include research experience, interest outside of academia, for example, utilizing literature reviews and research to inform and improve clinical practice.
Yes, you're almost right in the application now, aren't you? It's very good. Yes, yeah, any of those things, and certainly anything it may be you've applied research in your clinical role, but it may be that you've had some role outside of that, and you've done some research or you've used research in some way that you want to draw on that. But anything you think is relevant and pertinent to showing it's about showing that you've got an understanding of research, what it offers, how you might use it, or how you might undertake it. Anything that gives an illustration you've got those sort of interests would be beneficial in your application.
Thank you, Elaine. A question from Sonali. Applicants who meet eligibility criteria, especially research experience, lived experience, and are from underrepresented groups and have a clear research project idea, what areas would determine their success through stage 1?
I mean, I got to, how do I put this? I think the stage 1, I think there's about 6 questions, and it's all the things we've just been talking about, really. If I remember rightly, there's a question around equality, diversity, and inclusion. That's something that we're interested in. Wellcome are very, very interested in, wanted it to be central to the programme. So anything that thinks about that and addresses that, both from a personal level, professional level, and in terms of research. We're very interested in the involvement of people with lived experience of mental illness, or other service users. So anything around public patient engagement, involvement in research, we'll be interested in. But other than that, it's all the things that I've been talking about, really. It's what have you done so far? What are your interests? And then how do you see yourself developing a research, clinical academic research career? What sorts of things would you like to do in the future? I don't want to spell that out because there's lots of different types of ways of taking that forward. But certainly drawing on the things that you spoke about would be hugely beneficial in your application.
Thank you, all of you.
Thank you.
Are there any further questions? I think we've answered all the ones that have been posted in the chat. So if anyone wants to step forward and ask a question or put it in the chat. Sirad?
Hiya, I just wanted to check, is there like a cap on like the intakes, or is it just like a rolling thing that's fully funded over the next few years?
We have 5 years of when people can apply, and each year we're looking to recruit 5 people. And Wellcome are very, very keen for us to have 5 people each year. So rather than have 2 one year and then 7 another, they want us to try and spread it out. And we're keen to do that because we're trying to build a cohort of students who will sort of also provide some sort of peer support to one another as much as possible. And it also makes it a bit easier for us to provide support programs and so on when we have a group of people. So it's 5 people per 5 years. And then we also have a small amount of funding for a few pre-doctoral fellowships, so people who perhaps didn't quite make it to stay through stage 2, but we feel may benefit from another year further developing that proposal. So one person last year who didn't quite make it to the final list of 5 was offered one of those pre-doctoral fellowships and is now undertaking that and further developing their proposal. So there's a small number of those available as well.
Thanks, Helen. Anyone else with questions? Namrata?
Hiya, I just wondered whether you did have from your last cohort anybody from the allied health professionals or nurses recruited?
We did, I'm pleased to say. We have 1 midwife, we have 1 mental health nurse, we have a pharmacist, is that right? And a psychologist and a medic, is that right? Am I right?
Yeah, that's about right.
Yeah,
it's fantastic.
So,
Thank you.
so quite a spread, and another nurse who got the pre-doctoral fellowship. So, yeah, I mean, what's pleased me incredibly, obviously as a professor of nursing, but this program has included that explicit focus on trying to get more nurses in to the research workforce, because there's a real shortage despite us being the biggest profession in clinically, and there's strong historical reasons for that. So it's been great that this program has got that focus, and great that we've already hit the ground running on that. So I'm really pleased, and we want to see more.
Thank you.
Siraj?
Sorry, guys. Is the intakes only in September, or is there other months for intakes?
For those who would prefer to start in February, we can negotiate that. We're trying to encourage a September-October start, but sometimes it's just not possible for everything to get put into place in time, and so February is the other option.
Thank you.
Thank you.
We've got one more question in the chat from Charlotte. Will it reflect badly or impact our chance of success to proceed to stage 2 if we do not have a definite focus for our research yet at stage 1 application?
No. So obviously, if you've got some ideas floating around, that's great. But no, stage 1 is about you. It's about what you've done, where you're hoping to go, what you're hoping to achieve. and yeah, I've said it all before, I won't say it all again. And if you get through that to stage 2, that's when, over the Christmas period, early January, that's when you really need to be starting to think about, well, what shall I do? It wouldn't hurt to start thinking about it now. When people come to me not quite sure, I always suggest that they go away and think up 1 or 2, maybe 3 things, start to knock around some ideas. But what we encourage people to do very, very early on, if they get invited to stage 2, is to identify someone from our list of possible supervisors, and you can look at that list now online, and look at who you think might be suitable for the sorts of things you're thinking about doing. I think if you turned up at that point with no idea whatsoever, that's not great. I think if you're thinking about doing a PhD, I think any supervisor would be hoping to work with someone who's coming along with some ideas. Those ideas might be flexible, need further development, might be jumped entirely, and when you start to talk it through and you realize it's not quite going to work out. Sometimes people come with an idea which is, it's a great research idea, but it's not deliverable within a PhD because of the time and limited resources and so on. But I as a potential supervisor, I'd be a bit concerned if you didn't have any ideas, because this is all about, we're looking for people who are interested and got some thoughts and ideas. You don't have to have it yet, but early stage 2, some initial ideas would be good.
And just a note to the supervisor pool list on our website, it will be shortly updated with many, many more supervisors who have joined the pool over the summer. So please do have a look at that a bit later in the month as well, because there will be more people there.
Thank you, Nora.
All right, let's see, we've got a couple more questions. So Rianne is asking how many people get through to stage 2.
So last year we had just over 100 people applied, and we shortlisted 25, and I think we interviewed 22. I think 3 pulled out for various reasons. Interviewed 22, and then we've got 5 + 1 up and running.
And Sirad is just checking about the deadline for this one. So that's going to be 1st of December, 1 o'clock GMT for the stage 1.
Sorry,
right.
is there a way that because I'm considering it not for next September but the following September, because I'm currently at King's at the moment to do a module. So,
right.
So is there a way of being notified of when to start considering it for next year, for obviously the following year, or do I just need to look online and wait?
So we would generally have the application and the recruitment round around the same time. So opening in October, closing in December. So if you just keep that in mind, I think you'll be fine for next year. But of course, it's good to keep an eye on our website as well in case there's any changes.
Okay, thank you.
I don't know if you use social media at all, but we promoted it heavily on Twitter, so that's a good place to keep an eye out.
That's true.
Oh, I've got a professional account. I will go and follow. Thank you.
Yeah, do.
Great, thank you. Let's see. Oh, okay. I've got another question from Gary. My idea would be around the support for neurodiverse children. Would this cause any issues working with children?
No, I think as Rona touched on, anyone undertaking research with children and young people, there are obviously additional concerns around consent, capacity, safeguarding, particularly safeguarding. But those are just things you have to engage with and think, how do we best deal with those? They're not reasons not to do the research. And there are lots of research around doing studies with children and young people. So yeah, we would definitely welcome applications in that area.
Any more final questions? Please do speak up or put it in the chat. We still have a couple of minutes left.
Just to re-emphasize, there was a longer, or still an hour-long webinar, but more detail about the actual program we conducted last week. That's all up there. You can just click on that and watch that. It's got more detail about the actual components of the program and what it would look like over the 3 years. There's frequently asked questions on the website. Do have a look at those if there's anything you're not sure about. Yeah, and I think there was another question posted. No.
Yes, so Chubwood is just asking clarifications about the February start for the program.
Yeah. So application dates is all exactly the same. So if you were then offered a place, we would negotiate with you around the start. So it would either be September, October in 23. Is that right? 23, yeah. Or the following February.
Thank you. I think that's all the questions. And others comments, just.
Okay, so I'd just like to thank you all for coming along and for your great questions. Really helpful. Do check out the website, do have a look. I do hope if you're sat there thinking you might be interested, give it a go. Do apply, put an application in. We really do want to see applications from nurses and allied health professionals. And as you've heard, some were successful last year, which is great, and we hope some more will be this year. I want to thank Professor Rona Ross-Morris and Catherine Evans earlier, and particularly Nora for organising all this and handling all the questions. Thank you, Nora. Yeah, thanks very much. That's all from me. Nice speaking with you all. Take care.